Whole Body Solutions is a place that we offer many different modalities to help people achieve their maximum health potential. And over the years, we've found that people will reach a certain level and we feel like there's still room for improvement. So at that point, we always explore the different therapies that are available. And we had a couple of clients with ADD and ADHD that were doing very well with our nutrition and chiropractic and acupuncture services, but we felt like there was a little more room for improvement, and we came upon this technique and decided to bring it in, see how it worked, and our first couple of clients did really exceptionally well with the service, so that's why we brought it on. Well, every individual is born with a certain potential that's based in their genetics. And our goal is always to maximize that genetic potential. People can come about a decrease in meeting their potential through many different stressors. You can have a physical stress like a concussion or a slip or a fall. You can have a chemical stress like a food that you're sensitive to that's aggravating your nervous system, or a chemical in the environment, or many different stressors can bring us away from the potential that we're born with. The nutrition work we do deals with chemical stress, too much of the wrong things, not enough of the right things. And particularly for learning issues and brain health, you want to make sure that nutrition's paying attention to enough of the healthy fats, for instance. There's a lot of good research on the need for the omega-3 fats for the brain, for attention, for focus, for mood, for behavior. We've also found that foods can really drive chemical reactions in the brain that can aggravate brain challenges. People aren't even aware most times of the sensitivities to various food groups. And so working with the nutrition can take that chemical stress off. Whereas the hands-on technique provided by brain integration can work on reconnecting brain fibers and reconnecting neurotransmitters and getting that whole other level of hands-on from either the physical stress or traumatic stress on different levels that the brain has incurred. My favorite story, of course, has to do with my own son, who's now 10. And as I do with many of the services that we bring to the practice, I have my family assessed. And my son Cameron was an athlete, very avid baseball player. And I had him assessed. He had a little struggle with his handwriting. And as he became integrated, we left the office one night and went to a baseball game. And he hit every ball that was coming his way. And I recalled with Elizabeth, our therapist, that she had noticed he was having trouble with his eye movement down in one quadrant and that it was uncomfortable and stressful for him. And so she had corrected that and integrated it. And I really believe that he was able to see the ball better. And parents came up to me and the coach came up to me. People asked me what I had done differently because he was just hitting better. On a more, significant level, kids that can then go to school and not have the same stress that they used to have getting up and getting out the door in the morning because they actually could feel comfortable in their environments. Parents reporting that they're having an easier time with their children, and that's life-changing, and that's the kind of thing we've seen. I know in my field, especially with chiropractic, that you can have re-injury, as I'm sure you can have with the brain. If, with my son, for instance, he then continued on sports and he played football and he got a concussion, we had to bring him back in at that point. But prior to that, I'm told that the corrections are permanent, unless there is another injury or another trauma of some type to the brain. So there's a common belief that if a child has symptoms that might be labeled as attention deficit or hyperactivity or inability to focus or sit long, that as they get older and as they mature, those problems might just resolve themselves. That's not what we're talking about and what we're treating with our services in our office. This is a genetically determined program in the brain or a direct result of trauma. I know in my own son's case that we were reflecting on a potential injury he had when he was sledding. So you don't grow out of those. Unless you correct them, they tend to get worse, and or at least not improve. Okay, so ADHD is a neurologic condition. It is genetically determined. There is some science that substantiates a higher concentration of dopamine pumps in the brain of individuals with ADHD. And what that means is that the brain might produce healthy amounts of a neurotransmitter called dopamine, but that there are so many pumps that it gets pumped up and taken back into the brain before it has a chance to reach the next nerve and send a message. And as one of the psychiatrists that I spoke to recently explained, it's like having a really great team. The brain is excellent, but there's no coach coordinating it because that dopamine isn't able to function at its capacity. So how do the services help? Anytime we can take a level of stress off of a body, then the body is more likely to achieve its genetic potential. So if that neurological system also has some aggravation from wheat products or dairy products, or if that neurological system is suffering in addition from not enough healthy fats, or not enough of the right precursors to those neurotransmitters, that's where we can come. We take one stress off, and I'm sure Elizabeth can speak to the particulars of the brain integration and how that takes another level of stress or correction off the brain. So I think it's pretty fascinating because when I decided to have my son assessed, I brought him to work with me. And he was sitting in the office waiting for Elizabeth, and I was in with patients, and I didn't have a chance to tell her my concerns or some test scores that we had seen for him or areas that I had noticed some challenge. And she did her assessment, and she came to me and she told me exactly what I knew based on other testing that we had done. And so an assessment, I think, is imperative. I also have a 16-and-a-half-year-old daughter, and we had her assessed. No, there isn't anybody out there, I think, that hasn't had some type of trauma at some point and that couldn't benefit from at least a determination of is there room for correction. And not everybody needs the same number of visits, and not everybody needs the same area of the brain corrected, but that's the beauty of having a well-trained practitioner who can assess that and then deliver the appropriate service. I think the vast majority of our clients are here because they've already noticed a challenge. Not that that is the ultimate only reason to be here. As I said, my daughter showed zero signs of learning disability and still some areas that could improve and make life easier. So I would say if you're an active parent and you want to do everything that you can for your child, definitely bring them by and have Elizabeth do a consult and really get an assessment and see if you agree. You'll know what rings true for you and your family.